How is South Africa coping with Trump's cut to HIV funding? South Africa is currently facing significant challenges due to the reduction in United States funding for HIV programs. These cuts were initiated by the Trump administration in early 2025. The president's emergency plan for AIDS relief has been a major source of support for HIV prevention and treatment in South Africa. However, the recent budget cuts have severely impacted these efforts in local communities. In townships across the country, HIV prevention programs have been devastated. Community members are losing access to vital information and resources that are essential for managing this epidemic. Many people are struggling to obtain their medication, leading to growing fears of rising HIV and AIDS-related deaths. This is especially concerning as many individuals cannot afford or access clinics for treatment. The situation is made worse by South Africa's economy, which is not yet capable of fully replacing the lost international aid. The South African Ministry of Health has stated it can cover the gap left by the funding cuts, but the reality suggests otherwise. The suddenness and scale of these cuts have left many communities vulnerable. Healthcare providers and patients feel unprepared for these changes. In Washington, some lawmakers are making efforts to preserve life-saving treatments under the president's emergency plan for AIDS relief. There is concern about the impact of these cuts on global AIDS funding. However, the overall reduction in foreign aid continues to affect South Africa's response to the epidemic. Global health leaders are calling for renewed funding from the United States, especially for newer prevention methods like injectable pre-exposure prophylaxis. These methods could play a key role in controlling HIV transmission in South Africa. South African leadership is also encouraged to use international platforms to advocate for restored or increased support for HIV and AIDS programs. In summary, South Africa is coping with the funding cuts by attempting to fill gaps domestically. However, the loss of United States aid has caused significant setbacks in HIV prevention and treatment efforts. The situation remains fragile, with many fearing a reversal of progress made in combating HIV and AIDS due to reduced access to medication and prevention services.